Okay, everybody. I think we're ready to get started. Sorry for the delay. No, it's been a long haul, very busy couple of days, but we're nearly there. So. Nearly there. Okay. Okay. So I'm Amy Friedlander. Got a great group of panelists here for you today. Just want to take a couple of minutes to let you know what we've got in store during this session and to get us kind of grounded in what we mean by business intelligence. So I'm going to do some quick introductions, talk about what we think business intelligence means. And then I'm excited because we have lots of different examples of business intelligence in early child education being used, put to action, lots of different levels, from an alliance level, provider level, a funding systems level. So we have Virginia Marsh, who some of you, I hope by this point, folks have been meeting each other and getting to know each other. Hampton Roads Shared Service Alliance. She's got a lot of expertise in looking at data, thinking about early childcare, how to maximize revenue and support providers. And they've really done a lot of creative work in Hampton Roads and thinking about pulling together lots of different detail. How do you describe yourself? A data wonk or nerd or something like that, right? Like, you know, so there's like never too much data from Virginia's perspective, but, you know, then you have the challenge of, well, what does it all mean? How am I going to use it? How can I look at it in a way that's helpful to me as an alliance and share that information with my provider members? So you'll see a lot of the creative work that Virginia has done. We have Ms. Yvette Anderson, who is the administrator at the Right Start Childcare Program, and she's a member of the Hampton Roads Shared Service Alliance. And so she's going to share her perspective on, you know, how she's been using the data that the team at the Alliance have been able to help her access, how she's been thinking about it, how she's been using it, what it means to her and her business. And then Johanna Borden, who is a colleague of mine at Opportunities Exchange. We're very fortunate to have her coaching on our team. She also has a day job, and in her day job in Philadelphia, she is involved with our city's pre-K program. And so she deals with a huge amount of data related to eligibility, enrollment, and a lot of compliance areas. And she'll be talking specifically about enrollment, eligibility, and staff credentials and qualifications, and how that data is sort of how it's found, how it's collected, and how it's used to ensure the highest quality of Philadelphia's pre-K program. So that's what we've got in store. And just wanted to start with, you know, making sure that none of us were feeling off kilter by the term business intelligence. You know, like all things, this world deals with a lot of nomenclature. We want to make sure that, you know, we both give service to the formal definition and make clear what we as a panel, you know, what we think about as the term. And I think what's really key is that, you know, whether you call it data visualization or, you know, there are a zillion different lingo, business analytics, data mining, data tools. Now, the big idea here is that we need to know if we're making a difference or not. And the only way we can know that is through data or information. And we need the information to be presented to us in a way that helps us to move forward. So we know there's a whole slew of information that we always have access to. It's funny, we were talking this morning at the breakfast table about these, you know, Apple watches or these Garmin watches or all the information that's available. And my colleague was saying, you know, she can see her heartbeat and her, you know, her blood pressure. And I said, oh, you know, does it do you like knowing that? You can see my wrist, right? So, do you like knowing that? She's, no, no, but it's there. So that happens to us in a lot of different places and a lot of situations in this world. We have a lot of data. We don't necessarily need it. We don't necessarily use it. That's okay. But there is data that we do need, and that would be really, really helpful for us to have, and for us to have, trusting that it's accurate, to have it in real time so that we could actually, in real time sort of change course if needed. And so that's really what we're hoping to offer you. My expert colleagues here are going to share with you how they've been able to get this data and put it into an actionable form, because we know you have data needs too. So, providers wonder things like, am I making money? Should I expand? Should I invest in more marketing? Should I be open different hours? Can I afford to pay my staff more? Right? A lot of different pieces that providers are looking for. Networks or alliances want to know and want to be able to document that they're adding value to their members. They want to see, well, are we adding value to all of our members or maybe to some? If it's just some, why is it just some? Is there a coaching issue? Is there a geography issue? Does it turn out that being part of our alliance or network works better for those providers who are at a lower quality level somehow, or at a higher quality level somehow? There are lots of different ways that you could think about your impact. Should we offer different services? If we see that some of our members aren't, there's no take up or very little take up of a particular service, that's good information. Might help us think about offering something different. And then from a funding perspective, whether it's Head Start, Universal Pre-K, we know CACFP, we've got a CACFP expert in the house. We have a whole different set of questions that we need to have answered, and that ideally we could have answered with data that's really easy for us to use, right? It's been established with our specific need in mind. So, is the child eligible for this program? Where are they in the enrollment process? Are all the teachers qualified for their positions? So, I am hesitant. I said to Virginia, the Hampton Roads Shared Service Alliance has done this amazing work in really pulling data together from multiple sources and using technology really to its fullest to create dashboards. I don't want us all to think that Cadillac is the only place, that's the only way to define success in terms of business intelligence. From my perspective, for a provider to have a budget that she really understands and that she can use to track her actual spending and revenue compared to that budget, that's business intelligence. That's a really clear way for a provider to, you're taking information from multiple sources, maybe from your bank account, maybe from your CCMS, if that's where all of your accounts receivable is. You're pulling data together from multiple sources. You're putting it into a format. Maybe you've got some up arrows or some down arrows. Maybe you're using red and black. Maybe you're using parentheses, right? And you're creating a tool that can be very impactful for a provider. So the fact that my colleagues can impress us, please don't take that as intimidating. There are lots of directions to go with business intelligence. And before turning it over to Virginia and then she and Yvette are going to have a conversation about the use of all this data. Just want to say that from the Opportunities Exchange perspective, there are many things to love about the work that Hampton Roads has been doing in this regard. And part of it is that lining up, if you all have seen like our sort of shared services 101 or startup kit, we're really trying to tie together those big buckets of what are your provider needs? What are the services you're going to offer to respond to those needs? What then are the targets that you're trying to impact? What are you going to measure? And then over time, what's that big value proposition? What's going to change? And I think that, the data that is being collected really relates to that theory of change. And then it can be, because it's related to that value proposition, it can be used to kind of hold the alliance accountable. Are we really delivering for our members? And to then reinforce that value proposition and help grow the alliance. So with that, I will turn it over to Virginia.
And yes, I do like all the data that I get. I realized I'm sitting here with an Apple Watch and an iPad and a MacBook, and it's sometimes there's so much information coming in and my brain's just pinging. So I talk fast and sometimes switch gears. So if I lose you, just flag me down and say, hey, stop. This slide represents my brain because I feel like this is all the inputs that are constantly happening and bouncing around. My name's Virginia Marsh, and I'm here representing Early Education Business Consultants, as well as Hampton Roads Shared Service Alliance, otherwise known as HRSA, and joined by Yvette Anderson, who's the owner and director of Right Start Early Childhood Learning or Education Center. I knew I was going to mess that one up. And I just kudos to Miss Yvette. I'm so excited that she's joining us because we've heard a lot of the challenges about implementing shared services and getting providers on board, and how do you get them to implement technology, and how do you get them to participate? And I really think we won outside the gate with bringing Miss Yvette on to pilot shared services in our region, because we have changed software companies, payroll companies, whole 9 yards. And she's just right there with me going, okay, please just give me 6 months before you change something else. But just very open, supportive of our efforts. And we've really seen some great things that I'm hoping we'll get to talk about today. So Early Education Business Consultants started with my colleague, our company founder, Lauren Small, creating a business program for our region that we've been able to take nationally, which really boils down MBA level content into 8 sessions that our providers are able to digest and take those pieces and improve their business performance at their centers. And working with the centers, we do a lot of one-on-one coaching and consulting with them, helping them put those budgets into place, being able to assess the health of their business. And we've really seen the need for shared services, but also the need for being able to take all this data and boil it down into something that they can make actionable and quick decisions on. And that's been one of my frustrations, and I'll get to that in a minute because I realize I'm going ahead of myself. So Hampton Roads Shared Services launched in 2020. And if you don't know where Hampton Roads is, it's Virginia Beach, Norfolk, Williamsburg, all that little, what do they call it? 7 cities or something like that. The hub, which is managed by our company, Early Education Business Consultants, we've started, and I find it, when I was reflecting on this, I find it interesting that we're developing a 3-tier approach, but we started with tier 3. Like, let's just dive in and just take it all on. But that's kind of how we do things. But I think it's been a really interesting approach. It's been a little bit of a slower growth, but we've really been able to dig in and see and participate with the providers in what their struggles and their challenges are. And as we've been developing systems and streamlining, we've seen, shared services, we set out to simplify and reduce administrative processes at the provider level. But really, to make this happen, we have to be able to simplify at the hub level too, because we need to be able to process a lot of information and tasks, often manual tasks, in a faster way. So we've been able to take these processes and then say, okay, how can we maybe do this and offer this to more providers in maybe a less customized approach so that we can have an impact on the providers that we're offering full back office services to. And when I mean full back office services, we're doing enrollment. We're handling enrollment from the time they say, I want a tour, to the whole entire enrollment process, making sure we're tracking licensing documents. We're doing billing, tuition collection, payroll. What else do I do? We're doing, we've started taking on QuickBooks, billing processing. We've even dove into, we're doing some recruitment screening. So we're providing a lot of these processes so that we can alleviate that time and get them, the directors and administration, back in the classroom. So how can we do that but impact at more centers, but maybe not as much of a customized approach? And so we're pulling in some of these really technology driven areas where we can provide that as well. And then our tier 1 system, so we've launched tier 3 and we've launched tier 1 and we're still developing tier 2. But tier 1, we're providing, we've got about 200 providers participating in that. And that is access to our knowledge, the Virginia, I think, yes, the Shared Services Knowledge Network, as well as a monthly leadership academy, which is kind of like a leadership forum roundtable that we provide leadership, business, and quality topics, keep abreast of what's happening in our region. Our tier 3, we are charging our providers about $1,500 a month for all of those services. And that includes the software that we utilize in streamlining. And so for our alliance, we've chosen Alliance Core from Early Learning Ventures, as well as Leg Up. We found that that has been a really great fit, taking our enrollment and our families and our processing all the way through. And there's a slide on all the things that I just talked about.
Will you go back really quickly?
Yes. And this is on our website at hrssa.org. So I'm going to talk a little bit about dashboard journey. So as a director operating a single center, I was very frustrated. I'm a huge advocate for CCMS, automation, technology everywhere possible. In fact, in our company, before we hire an additional member of our team, we ask ourselves, is there a software, is there automation that will handle this for us, so that we're not also in the hiring crunch that you all are in, right? Or that our providers are in. But we really want to employ technology wherever possible. So as a director trying to process all that information, and with all the multiple hats that they wear, finding that if I wanted to see the health of my business, I probably had to run 5 to 7 individual reports. And I would run one, get distracted or pulled away, forget that that happened, and then come back. And it was just a disconnected system process, and I wasn't really retaining. You know, in working with our childcare providers, we've realized they can run a P&L, but it's a lot of numbers, it's a lot of data. How do we help them make decisions on that? So when we started working with the hub, we had an Excel spreadsheet, and we were running all these different reports and data entering them in. We quickly realized that as we were scaling up our shared service alliance, we were going to quickly be at capacity for that data, manual data entry, and running those reports. And so we started looking at, how do we make this simpler, and how do we provide data to our providers in kind of a one-stop shop, so that they could just look at something, know what they have to act on from an administrative point of view, and then get on with the rest of their day. So I wanted to show you, we've worked I've had the opportunity to work with several of the childcare management systems, but I'm specifically have had deep interactions with ProCare and Alliance Corps. And so I wanted to just take a moment to show you a couple screenshots of what their platforms are offering in the form of dashboards and why we chose to kind of go in another way. I think there's not really any perfect childcare management software out there. I think there's a lot of really great software out there. I think they give the tools to centers to manage the day-to-day businesses and to engage with their families and give the families what they need. I think that piece that a lot of owners and directors need and management teams need is that consolidated dashboard of the health of the business. But I think one of the challenges is we're also, sorry, I gotta get some water, is trying to bring in outside sources because not all information is from that childcare management system. So this is a screenshot from ProCare. It does give a revenue comparison. It does a great job of providing child staff ratio and attendance, weekly full-time equivalent attendance, as well as birthdays, because that's important. We got to celebrate those, right? And then ProCare Cloud does basically the same thing. ProCare Cloud also gives app usage. So you can see how many pictures are being sent, how many messages have been sent. So it does give you some of the health of the business, but it's very limited. You can't, it's not real customizable. Early Learning Ventures Core, similar data, but then they've taken it even one step further. So if you want demographic information, you got it. There's a whole bunch of demographics. And so if you're having to report out demographics on your enrollment on top of some of the other things, I think I went that pretty quick, but they add in daily attendance, monthly attendance. They do have a percentage of capacity. They do have a snapshot for your accounts receivables, as well as all the demographic information. But that's only the data that you're pulling into the child care management system. These are all the different data sources that we're trying to pull in and assimilate for our providers. So, and in ProCare alone, I was running between 5 and 7 reports per center to get the data that I needed. And then utilizing state subsidy, there would be 2 reports per provider, and so forth. So there's a lot of different data sources and a lot of manual data entry. And so I know this, the last session I was in, she said, I got to go to presentation class. And I feel the same way. I think we want to present a lot of information and a lot of material, and then it gets smaller and smaller. You can't hardly see it. But this is just a snapshot of what we were doing in Excel. So we're running all these different reports, data entering each number that we needed, and then having to update. And at this point, when I was working in this, I had 2 centers, and I was dreading adding that 3rd one on because I knew every time I added a center, I was going to have to reconfigure all my formulas to bring that next center on. The other thing that was frustrating is it's kind of hard to lock systems down. So if your provider went back in time, maybe 2 months ago, 3 months ago, and voided a transaction or they forgot to unenroll a child, all the data was different. And if you wanted to keep your dashboard up to date, you have to go in and run all those reports again up to when the change was made and bring it up to speed. And so when we started looking at BI software. At the time, I didn't even know what BI software was. But there's got to be a different way. There's got to be a better way. There's hundreds of BI software out there. And basically, I'm really kind of a layman with this. I do have a background in data analytics, but it's not extensive. I am nowhere near some of these other presenters that we're talking about, the big data warehouses and data lakes. I'm not there. to me, this is my Wordle every day. While you all are figuring out your 5-letter words, this is what I'm working on. It's like my Sunday crossword puzzle. But we found a company that we could self-service our business intelligence. And what I mean by that is there are companies out there you can contract with, and they can set it all up for you, and they can bring in your data. And it's really, really expensive. And for our small company, that wasn't an option for us. Even employing this, we decided to go with a company called Domo. And it's a lot like Power BI, was it Tabular? I probably looked at so many, probably 20 different companies before we settled on it. Because of the size of our company, there were some that wouldn't even talk to us because we just couldn't come in at the level that they wanted us to. But Domo was really, they worked with us to get our foot in the door. So it's been like learning a new language for me. And I'll be totally honest, our upfront investment was, I think, 17,000. And then it's like another 10 every year or something like that. So it's a little bit much to get into, but when we did the analysis, we realized we were going to break even right about center number 6. And then from there on, it was going to be a game changer. And then we can use it for other aspects of our business and reporting other outcomes. So this is what a sample of what our dashboard has turned into. And I'm actually going to flip over to the live version so you can see how we're utilizing it. So we provide our providers with 2 different reports. We provide a weekly report. We actually do issue this 3 times a week. It's a live link for them. And it provides them all in one place, an update on their licensing inspections. So when their inspections are coming due, it will change colors to give them like a 2-month head warning. Hey, this is, be thinking about it. Within the 1, it starts turning orange. And then if it's overdue, it's red. But it just says, hey, this is something that you got to keep your eye on. It gives them their outstanding balances in an aging report. It gives them their enrollment by classroom. And we utilize Leg Up. And so this helps us coordinate with the centers, how many open positions that they have and how many positions we should be have posted on Leg Up for that enrollment. So that's helping us to drive enrollment up. We manage missed swipes. So it'll tell us every family and what swipes they've missed so that we can ensure that those providers are getting those swipes so that they can get their revenue. And I think I might have heard, so missed swipes with our subsidy system, sorry, I heard someone say, what's that? With our subsidy system in the state of Virginia, they have to swipe when they come in. It's starting to phase out, but they still have to swipe at least once a week for the provider to get paid. And so we've just maintained that we want the families to keep swiping just to ensure that we're not missing any revenue coming in from that. What's that? We're using ELV, yes. But this report we have to download from the subsidy portal to get that information. And somebody was downloading that report, filtering it out, trying to figure out what days were missed. And now what we do here is our admin person runs the reports, saves them in a Google Drive. Our Domo software, she doesn't even have to open the report that she downloads. It picks it up out of that Google Drive, brings it into the software, standardizes the data, and then produces the report. So, and we're working with ELV to hopefully do an API or some type of a data transfer so that we can cut out that report running. But what used to take her a good hour a day now takes her 5 minutes to run the report, dump them in the folder, and she's done. And then these are live links that we provide the centers. This also provides staff licensing. And so this was an old, because we've since cleaned this up quite a bit, but this will tell the provider any documents or training or background checks that are either missing out of a file. It may be in the paper file, but until they've scanned it to us and we've uploaded it and documented it into the child care management system, we don't consider it received. And so we document it and then it vanishes off this report. But then when it gives them a 30-day heads up that if it's expiring, that it needs to be dealt with. And then we do the same thing for our child licensing documentation and physicals, those things that have to be renewed or updated. And we also do it with enrollment documents so that we make sure we have a complete licensing package. Yes, yes.
Can you ask, say the question.
Oh, I'm sorry. The question was, are we doing all this for the provider rather than the provider doing it, running the reports? We are running, we have access to all of our providers. We run payroll, but their subsidy portal, all of those systems so that we can run those reports for them. So essentially they get this link. Miss Yvette, how do you access the report?
At my desktop, I just click on a link and everything is right there. I get it 3 times a week, and it's really what my focus is. I guess I'm supposed to be talking here. My focus is, for instance, if I see something that is missing from one of my staff members, and that's my focus that week, to make sure that those things are taking place.
So we've really tried to make that a very quick, she doesn't have to run any reports. She doesn't have to think where to, because sometimes that's a barrier, because you do the training and the provider, doesn't remember, where did that report, where was that report? What was it called? How do I get to it? And now you want me to run 6 of them? So we've been able to give one link, and we actually will go in and put a bookmark on their bookmark bar so they can just click on the link and have access to it. But we also send the link in an email. And so she was even looking at her dashboard today from the link in her email. So this is the weekly. And Miss Yvette said, she looks at it. If there's something missing, something that needs to be updated, if there's a parent that is having a balance that problem, she has that all right there. She knows who she has to talk to right away. Is there anything else you wanted to say about that?
No, I would like to say that as a director and an owner, there are so many other things that take place during the day, and to have this simple document that I can refer to, has been wonderful. And I know Virginia is going to share some on some of her other slides, but it has made a tremendous difference in the operation of my child care center.
Thank you.
Do you do any sort of analysis over time where if you note a trend that's starting to happen, do you flag that for the provider? So I hear you saying you send 3 reports a week, and it maybe things are going on and you're going, wow, this trend is continuing to happen. Do you sort of bring that up? How does that happen?
Yeah, great question. The question was, if we notice a trend over time that's happening, are we able to manage that and bring that up and address it with the provider? And in fact, that's a great segue. That report that we provide is what we call the weekly status or status report. So that's really those day-to-day administration pieces. Their other report that we provide is this report. It's a monthly report. And just one of the things I wanted to share, rather than running these 5 to 7 reports per center, one of the reasons we chose Alliance Core was because of their data accessibility. We are able to run all of our providers, all the data in 5 reports. I think we've added a 6th one, but we're taking the raw data in 5 reports and uploading it into Domo. So every time we run those reports, we're updating all of the data and our charts are up to date. So there's no more going back into time and having to rerun those reports. And we're really, the goal of our monthly report was really to look at that iron triangle data, enrollment. And you can see, and if some of these are a little bit hard to see, but these are interactive charts. So the provider can open it up, make it bigger, and you can see the nice trend line that their enrollment has done over time. And so if we see something like, ooh, there's been a dip, there's been a change, and I'll show you some specific ones. So we do enrollment, we look at revenue. This is one that I particularly like. We just talked about this a couple weeks ago, because this chart here, the green line is tracking, that's the revenue per average revenue per child per month. Like I said, this is kind of new to me. And I'm not, this data analyst guru. So I'm still very much learning this as we go. I have plans for like 3.0, 4.0 down the line to be able to really look at that true cost per child or true cost per age group. We're just starting with the average cost right now, just to get us going in the right direction.
Virginia, could I ask, someone on Zoom is saying, it looks like you're on a public version of Domo. Does that mean it's potentially visible publicly?
Potentially. And that's another thing. Yes. So we are giving them a link that's to a public version. And that's why we're sharing our sample version. Eventually we will get into where we're sharing a lockdown version. It's just kind of where we are right now.
Thank you.
So the blue line here is the average expense per child. And what we coach the providers on is we want to see this nice little gap. And when there isn't a gap, we want to make sure, okay, what happened? And so you can see, and this is December of last year, I was like, whoa, what happened? So I do some initial things. I dive into QuickBooks and take a look at it, like what was happening. But then Miss Yvette and I were able to have a discussion. There were some things that happened bonus wise in December. There were some year-end expenses and adjustments that had happened. And I'm trying to help me.
I believe that was at the same time that I hired a new employee as well.
Yeah, absolutely. That was right.
Yeah,
I remember that now. And then we also talked about, so after we had this discussion, I don't know if you remember the conversation about how you were going to go back to your bookkeeper.
Right.
You want to share with that?
So my bookkeeper has not been giving a regular report. And so, for instance, if there is a charge that is taking place every month, but she is putting it together 3 months later, it really changes the way Virginia is able to report certain things. So after having the conversation with Virginia, I was sharing that I will speak with her to make sure that it's done every month so that we can get a true picture of, the expenses and profit and loss that takes place with the center.
Thank you. So that's an example of how we utilize those reports. We see something that's catches our eye, and we just want to make sure that there's either a reason or that the trend isn't continuing. Another example that we would love to show is the accounts receivables. And a lot of times I turn these numbers into a percentage of revenue because, between the 5-week 5 weeks of tuition, 4 weeks of tuition. Sometimes there's 3 pay periods, all of those different things. It makes it kind of hard to see where the trends are. But you can see accounts receivables, and we're only looking at anything over 7 days old. And for our state, we're only looking at data that's for parent pay, because our state does a really good job of consistently staying on and paying. This is what we're zoning in on. But you can see, it gives us the ability, we can annotate, because we saw that accounts receivables started to decline. And that was a moment we said, whoa, what's happening here? And we realized this is when we changed payment companies. We switched, we were utilizing one CCMS and we moved to another CCMS. And there was this transition period with the families, you know, what, I can't pay there anymore. Where do I pay? And then so things started to climb back up. And I don't know if you want to speak to, because since January of this year, I think she was close, she was at 15% in January, and just this in March had brought it down to, I think, 4%, 3-4%. So she's had, just since January, a 11-12% drop in her accounts receivables. And you want to talk about how you use those 2 reports together?
So as Virginia mentioned, we receive 3 reports each week. And on the report, it states, which parents have not paid. The back end of it is that prior to me having to say something to my parents, the assistant in the office with Virginia and Lauren, they have contacted the parent. And that makes a big difference for an owner, because that person is thought of as the money person that's, going to hound them, or they're going to make sure that they talk to them about the money. And we, the parent and I, we have a better relationship. We have a relationship based on the well-being of their child versus money. I'm trying to get your money. So Charlene is the person that contacts the parents. So if at some point Charlene is not able to get in touch with the parent, then that is when I step in and I'll say, Miss Jones, Charlene has been trying to get in touch with you. And right then they know, So I think having that level of support, taking it off of the owner, but if it comes to that where the owner has to say, or the director has to say something about payment, we step in, but we have that notification multiple times, so we don't let it get behind anymore. And it's easier to pay $100 than it is to pay $300. So, we jump on it right away.
Thank you. So that's, I could spend all day talking about these. But really, from the reports that our admin is running 3 times a week, the weekly status report's done, the monthly report is kept up to date. So at the end of the month, really the only thing I wait on is things beyond our control, like the bookkeeper completing her monthly tasks before I can upload the expense data. But the majority of it's ready to go. There's no additional work that has to be done. So it's really been a huge time saver. It really gives us actionable items that the provider and our hub can work off of almost immediately.
One other thing I'd like to also add is that when the parents sign their child in and out, they use a QR code. And in that, when they get a message as far as the payment. So that's another level, so that it's a message that tells them exactly what is owed or what is due, if it's a licensing issue. And so that form of communication is just another level for communication with parents.
Yeah, one of the things our providers love about our accounts receivables assistance is that they feel like they have a corporate office without having a corporate office. They're still in control of their business, but they can say, oh, well, I mean, Charlene called, let me see. And they still have that ability to be that nurturer, whereas our back office person is a little bit more heavy, hey, yes, the enforcer. We used to call her Boots. But yeah, that's about what we've gotten.
Right. Oh, what did I do? Okay. So you gave me a good segue. A lot of the stuff you talked about, I will also be reinforcing in some of the data collections that we do at PHL Pre-K. So I'm going to talk about 2 data points. Our providers really have to collect a lot of data to report back to the city. So I'm only going to be talking about 2 today, but wanted to give you some of that background. So my day job is working for PHMC. It's a public health management corporation. It's a nonprofit public health institute, and they are currently the intermediary for the PHL Pre-K program that is city funded. So it's we provide quality pre-K programs supported by the Philadelphia beverage tax. All Philadelphia children who are 3 or 4 and by September 1st are eligible, and there is no income or employment requirements. PHL Pre-K funded seats are intentionally located in neighborhoods across Philadelphia with fewer pre-K seats. So that was a really big push for the mayor. Higher poverty areas and areas where there's greater childcare burden. In 2020-21, we had 3,300 seats, about 136 providers. This year, in our current year, we have 4,000 seats, 156 providers. So that shows you right there how much data we have to collect across our 4,000 children and our 156 providers. And in the coming year, we're slated to increase seats. So again, we're always thinking about our data collection, how we can make it easier, what should we be thinking about, what should we be doing. And since its inception in 2017, we've served up to 10,000 kids. So really great program that the city has. So I'm going to talk about enrollment and the application and approval process. So that's a really high risk activity for us. We want to make sure that the children enrolled in our PHL Pre-K program are age eligible and live in Philadelphia County. So how do we do that amongst our 156 providers, right? So we have a system, it's called Childware. So shout out to Heather, who is virtually participating today. She is a colleague and she works, she is our Childware manager. So her and I work very closely together to ensure that our data system, Childware, is collecting the information that we need to appropriately go through the approval process. So our 156 providers enroll children, they enter the information into our database. We get notified that the child has been pre-enrolled. That's the language we use, the child's pre-enrolled by the provider. Once a child's pre-enrolled, we go in and look at the child's record. We ensure that the child residence yellow. There are safeguards within the data system to ensure that when you're putting in the date of birth and you're putting in the address, it tells you that the child's eligible. So if you put in an address that's not in Philadelphia County or a date of birth that is not age eligible, it'll give you red flags, right? So that the provider knows that the child cannot be enrolled. Once that happens, our team reviews that application, approves the child. We notify the provider of that approval. So again, we have one team member looking at all these child profiles and approving 4,000 children. Obviously, it's a team effort, we all support, but it's going through, the hands of one person. So the data system is really important for us because if it's doing what it needs to do, as it does, to make sure that the child's eligible both for age and residency, and makes that job easier for us. So that's the approval process. Another good thing about the data system is that there's a home page. So when a provider signs in, or myself, to look at how enrollment is doing, there is that home page that gives all that information. It gives us the provider. It gives us how many children are currently enrolled and approved, how many children are pre-approved, but not pre-enrolled, but not approved, so that we know real time what's happening across the system. And so we can report back to the city and say, this is how many children are enrolled, this is how many children are entered in the system, we're still reviewing and will be approved for enrollment. I kind of said that in so a lot more in that I'm covering in this slide. But again, we can see the number of enrolled children, number of approved pre-enrolled children, number of unapproved pre-enrolled, and then number of applicants. So wait lists, right? That's what we call our wait list. So we want to make sure that all our providers start a wait list in the system. This is important. Why? The city wants to make sure full utilization of the slots are being used, right? We want to make sure that the money that we are getting from the beverage tax is going to providing seats for these children in the city of Philadelphia. So we monitor enrollment twice a week. The system allows us to pull out a report that shows how many of our providers are fully enrolled or at what percentage they're enrolled. We track vacancy trends. That's another big thing that we ensure that we're tracking. So for us, a provider that has a vacancy, at least one, for 30 days or more, we're reviewing that monthly. We're doing that for a few reasons. Again, we want to ensure that full utilization of the slots are being utilized, but we also want to see trends. So we look at how many seats are empty, maybe at a certain zip code, how many seats are empty in a certain neighborhood. This really helps us go back to the city and say, you know, let's think about additional marketing and recruitment efforts for this provider in the zip code or in this neighborhood, and then tracking applicants. So if there are seats in the system that are vacant and the provider just can't fill them, we can move those seats to another provider, right? It's our reallocation process. We can move those seats to another provider, and the system helps us track the wait list so that we can say this provider in this neighborhood, we're taking seats and moving them over, but they have a wait list. So we know that once we move those seats over to that new provider, they can easily enroll, which helps our enrollment overall. So again, it's used for recruitment. It determines annual seat allocation. So each year providers apply to be part of the PHL pre-K program. They're not just, they don't just continue on each year. Each year they have a new contract with us and they have to reapply. And so each year we analyze the seats, right? How many seats were filled throughout the year? Where were there gaps? Where did providers struggle? So the data system really helps us kind of pull that information together so we can determine that at the beginning of the school year. So that was enrollment and the approval process. And we talked about the childware database, which is what we use. Childware is a PHMC program. So it's the great thing about the childware system is that it's internal, right? Heather, who I shouted out, is someone we work with really closely to make sure that all the data that we need to collect for the city, that we're collecting in the data system. And if it's not, we're working on, creating new features and functionality really to make sure that we're collecting everything we need to collect in a manner that's easy, right? That we're not using an Excel spreadsheet to collect all this information. So that's enrollment and approval. The other big thing we need to ensure that we're collecting is staff credential data. So our providers must meet our PHL pre-K staff qualification requirements. They're responsible for submitting their credentials within our PD registry. So that's a workforce registry that is used to track employment, education, and training history. It's also licensed by the state of Pennsylvania. And we have a data sharing agreement for PHMC so we can view the provider data in the registry. And so this is a compliance measure. We need to make sure that our teachers that are going into the system are qualified based on our requirements. So a lot of the work that was being done here was through Excel spreadsheets. We had 156 spreadsheets, one for each provider with all of the staff. So we talked about spreadsheets, right? With all of the staff and their credentials. On top of that, our staff had to look at their credentials, right? Had to determine based on how many ECE credits they had, were they eligible? that's a lot of work in the beginning of the school year to ensure that all our staff in these classrooms are qualified. So what we did is that we partnered with the PD registry and the software company that built out the PD registry to create a PHL pre-K, what we call module. Within this module, we're able to have, our providers are required to enter their data in there as a star-rated provider in Pennsylvania. And so they were required to enter data in there already. Why were we doing double work, right? We didn't want to do double data entry. We didn't want to do double work for our staff. That's a lot of time spent for our staff. So we partnered with them, created this PHL pre-K module. They have to enter the data in there anyway. It gets reviewed and a career pathway level is assigned. So once that happens, we go in there, compliance staff goes in there and determines based on the level, are they compliant or not? They also determine, are they compliant for an assistant teacher position, a lead teacher position, or any other position that qualifies depending on their credential. So it eliminated that work of us having to do that review of credentials and transcripts and putting the information into Excel spreadsheet and then taking that all those 156 Excel spreadsheets and putting it into one to report back to the city and say, these are how many teachers, lead teachers, assistant teachers are qualified at this level. This is their credential. This is the type of credential they have. That's all data that's very important to us and we need to report back to the city. So with this partnership, we really ensured that providers weren't doing double work and then we weren't doing double work. I kind of explained a little bit how this works. So providers and staff have to work within the registry. Again, they put in their information into the registry. They self-report and upload all their education credentials. One of the registry staff members review their employment and credentials, and then they go through the whole process, and then they're assigned a career pathway level. And then us as an intermediary, again, responsible for the compliance, we review the staff report, pulls a really nice report for us based on that information, and we're able to report back to the city all of those data elements. This is just a visual of the interface of what it looks like. So if a compliance staff member is in the system, they would see the staff, the teacher's name hyperlinked. It pulls up a credential report, and the report shows the status of the degree and credential. On the back end, we're also able to pull it in aggregate. So that's the second, number 2, that's the compliance section. So the staff can flag the teacher and the classroom as compliant and not compliant based on that review. And this is what the report looks like. It gives us the program, the teacher's name, the position, whether they're full-time or part-time, their career pathway level, the date, if it expires, that's another really helpful data piece for us. The classroom, the teacher compliance status. So you can see in the teacher compliance status, you get those yeses. NAs can mean that they haven't applied, so that we're waiting for them to upload the information. So again, the use of the data and the analysis that we have to do is to verify the staff's credentials. We want to make sure that they're compliant with our PHL pre-K requirements. We are able to look at the number of classrooms tagged as PHL pre-K. We're even able to look at the mixed funding that's within that class. So if a provider has Head Start children within that classroom, we're able to see that. And then the PHL pre-K seats, I shared that, the mixed funding, teachers assigned to the classroom, so we can see the teacher's name, right, what position they hold to that center. And then staff turnover and staff retention, which is really important data, especially right now, right? We're struggling with ensuring that all our centers are fully staffed. So we're able to see trends there with the staff turnover and staff retention.
Thank you. We wanted to leave plenty of time for questions, and let's see, we've got one from online. Was this that I believe is for you, Joanna, about childcare? Was this management system built from scratch or an existing framework?
That's a great question. So childcare, there's a 1.0 and 2.0 version. I was lucky enough to work on both versions. The 1.0 version was really, we worked on it personally, I worked on it as a Head Start manager to really ensure that we were getting all the Head Start data in there. So the 1.0 version also has some other features that clients can utilize. The 2.0 version was specifically designed for our PHL pre-K providers. So that 2.0 version is only utilized for by our PHL pre-K providers. And Childware is always looking to enhance and add more features and functionality depending on the needs of their clients, whether it's our 1.0 version or our 2.0 version for our PHL pre-K providers. So it is a homegrown
So want to open it up to questions, and we frustrate the folks on Zoom if we don't use the mic. So I apologize. It takes a little bit of mic running, but it's worth it. So if anyone has any questions, we're happy to try to answer those. I think it's kind of interesting to think about, because a lot of the work that we do at Opportunities Exchange is thinking about what kind of bridges can we build between CCMS systems and state systems. And we heard, Virginia talk about pulling in that swipe data, that's the subsidy data, and the childware system is, from a funder perspective, they're trying to create a data system that can help them ensure program compliance and payment, et cetera. And it's just really challenging to get everybody's needs met. And I think, for those brave folks out there like Virginia that are ready to dive into this, business intelligence, this software and this data dashboards. I mean, we have some folks on Zoom who seem pretty knowledgeable, and they were like, oh yeah, that happens. It's usually, publicly available until you have enough customers or enough data or you pay enough, and then it's, proprietary. So it's like its own world out there, but we see the challenges, the variety of data that we need from multiple places really does, it can be confounding. So I think as intermediaries and folks that are building systems and projects and programs and initiatives to better support providers, we don't need everyone to be a data dashboard expert, right? Is that of interest to you?
No,
No.
not at all.
No. But it's of interest to Virginia,
Mhm.
and she can do that on behalf of, the 3 members and then the 6 members and the 46 members. And it's very effective. It's that, kind of economy of expertise. So that both the cost of the software itself and the ability to collect all the data and get it in the form that's necessary for the system to work is really kind of an interesting way to think about. It's not only about how the hubs, the shared service hubs, need to work efficiently and effectively, because we don't want the hubs themselves to get so expensive that providers can't afford to pay for that service, right? It's not going to be $1,500 a month. It's going to be, $2,500 a month, or, so we have constant pressure on us to keep our administrative costs low, kind of walk the walk. And this is one such approach. And from a funding system, I think we know that these state systems are very complex. There's, a subsidy system that's different from a PD registry, that's different from, licensing data, perhaps, and that's different from a government funded search function. And so, government administrators are hard pressed to sort out how to make those connections. And I think really need to look to what can be done. We've got a lot of vendors here that have some ideas and have some expertise, but I think particularly, I know more and more states have PD registries. I think it's really interesting to think about, how alliances or funded, projects that provide funding for specific slots, how can those other systems pull data from those registries or use that data effectively to establish policy or otherwise kind of support providers.
That is a key question I have about the data registries. I think are a huge wealth of opportunity to reduce duplication. And so I have two questions that are maybe a little in the weeds, but it would be, I think I would find it helpful. Hopefully others would as well. One question is, are you a .gov or a .org?
For PHMC, .org.
.org. Okay, so you are, sometimes .govs have easier access to things in
Yeah.
terms of getting data out. So I just was interested in that. And then the second question is, how do you request the data? Do you have like a standard request where you say, these are the ones I want the records pulled? Do you use an API? Do they do a download where they give it to you on a, I'd love to just hear how that
Sure.
works. Like, is it an annual request that you get it back and then you manipulate the data? Or I just would like a little deeper dive.
Yeah, no, that's a great question. We actually have a module within the system. So we have access to that data real time, right? So I can go into the module, I sign into my PD registry using my PD registry account, and then I can use my dropdown to find our PHL pre-K module. So that information's already in there. So what we do is we partnered with them to give them the list of our providers. This is who we need access to with our data agreement. And we have that within our module. So we don't have to request reports. We at real time can have any of that information that we need, because we have to present that to the city each week, right? The city wants to know what our progress is with teachers, especially right now, because we're struggling with having, teachers in the classroom. So it's actually within the module. So we worked with the software company that built out the PD registry to create that module. So yeah, it's lovely. You can go in there, at any time and pull that. And they have a analytics software that is linked to the registry, and we can customize reports. So, we can say, I want, specific data on maybe 4 data points, but I don't want to pull 4 or 5 reports, right? So it customizes the reports for us.
Virginia, I have a question for you. You were talking about like the pricing at one point about like for the centers, it's $1,500. And the price surprised me. It sounds like a lot, but I know centers have more financial potential sometimes than like home childcares. And so I was wondering what challenges you might have run into with getting programs to buy into this and recognize their need for data and reports and things like that. What challenges you ran into and how you addressed them, getting people to buy in.
Yeah, in fact, we were just talking about how we've kind of evolved, because at first when we were talking about the price, we were like, oh, no one's going to want to, and then when we started really talking about what the providers are, what the services that we're giving and the level of services. And if you break that down and compare to if they have an admin person in their center, they're getting really high quality, we do marketing efforts for them, recruitment, all of these things, they're getting really high level services that they probably wouldn't be able to hire the equivalent if they were hiring somebody at 20 hours a week or, so we start to explain that. And then as we start, some of our providers aren't on subsidy yet, and we're able to kind of help navigate that. Or, one of the second provider that we brought on was completely manual. And when we were talking about accounts receivables, they said, oh, we don't have an accounts receivable problem. And I'm like, well, how do you manage that? And she's like, I just know. And when we got it all loaded into the software, and within 3 months, they had an accounts receivable problem. And so it became very evident that being a part of HRSA and having somebody help with this was a cost savings measure, and we were helping them. So when we can get big wins up front, and then some of them, we're eliminating another additional cost of a bookkeeper, or, we're bringing as much in-house, and it takes, for us, it's about, we have our admin person is meticulous about timekeeping, which has been really a nice added bonus for us figuring all this out, because we figured it takes about 20 admin hours per center per month to process.
from a personal standpoint, during the pandemic, when there was a shortage of workers, it was a benefit to me because that was one area that I didn't have to focus on, because I was being pulled to be in the classroom. I was being pulled to do other things. So, I know sometimes people look at the cost, but it is either going to be left undone or it's going to be half done. So the fact that I can depend on an organization to run that part up for me, it frees me up to do some other things. So.
And, the providers don't have to worry if the admin calls out sick, payroll still gets run because we've got a backup for our admin. And we handle it. If our admin goes on vacation, we work together on that. And the other piece of that just left, it's gone.
Do you have a scale pricing depending on the size of the program? Because in comparison to a center base versus a family child care home, even a large family child care home, there's the dynamics of that back of the house. Responsibilities are lesser than the center. Do you take that into consideration?
That's something that we've talked about quite a bit. We have not gone into the family child care support at this time. And interesting enough, there's probably a 50 child difference between our first two centers. And what we found is that once the implementation is done, and we help get turnover of both children and students to level out, the cost is about the same. So we don't see an influx in cost on the size of the center, but the majority of the centers that our optimum center is going to be between that 40 and 80 students. And so we really don't see much of a difference between that. So the scale, there is no scale at this time.
For your current system, what is your scalability?
With the staffing that we have right now, we anticipate we could do a total of 10. And before we want to add in another person before we get to 7 or 8 so that we have that scalability. But from a dashboard perspective, there's sky's the limit on that. In fact, we're looking at once we're comfortable with the quality of our data, we're looking at a possibility of that something we might be able to partner or work out that we could offer those. There's another component to that. We're providing this data by running all the reports, but what we're looking at for our tier 2 model is having like a Google form that the provider fills out themselves with their data. It helps us collect data, but it can turn around and produce those reports for them, but they're doing the work.
So Virginia, there's some questions online and I think you've sort of answered it, but so, that if the price is the same, and I think it's I'm so happy you asked about the membership pricing because I know there are alliances and networks out there doing terrific work that ultimately we really worry about how sustainable that work can be if there's not, and you heard, Shay speaking about Texas's plan, or maybe that was in a session, not the plenary, I'm sorry. But anyway, so she spoke to, the idea that the model that they're working to stand up in Texas is that there's government funding for initiation, and a couple of years of support, but there's a requirement that the alliances that get funding from the state will charge a membership fee. So because I think most of us feel pretty squeamish about that, right? Because you both want to show the savings first, but if you go in without having charged, it's much harder to start to charge later, right? So I think there's a real push and pull on that. But there was a specific question about, can you help me explain, like, how can a center with 10 kids afford $1,500 a month in the same way that a center with 50 kids can? And I think you might have answered that by saying, well, they probably can't, so they might be better off in tier 2, where they can do some more of that work because they have fewer children enrolled. There's less, less of everything, less documentation required, less numbers to submit, et cetera. And then you can offer a more affordable price for a scaled down set of services. Is that correct?
Yeah, and thank you for reminding me what the thought was that escaped. All of our centers right now, we've done our pilot and the first couple years off of a grant. And so there's been a gradual, we like to have some skin in the game from the provider from the get-go, but there's been a gradual building to that full price. So by the time they're in 3-4 months and their fee is starting to grow, they've already had those wins and seen the benefit and realized that their participation far outweighs the cost that they're paying for their membership. And yeah, I mentioned that we haven't gone into the family childcare element yet. And, I feel like shared services, we're jumping out of the plane or flying the plane, building it while we're flying it, and then we're jumping out without a parachute and we're trying to sew that up while we're jumping. There's all these things we're constantly reevaluating and making sure that we're giving the best value to the provider, and then also making sure that we're doing right by the alliance.
Thank you. Hi, I'm Lauren. I work with Virginia. Yes, and just to add on to that, we haven't developed the family piece yet. Our state is invested in Wonder School, and we're still trying to figure that piece out. But what's cool about this ability to put information in a way that you can make decisions, our next step with our alliance would be to start trying to aggregate the data from all of the providers to show how our alliance is performing and to see if we're having the desired impact, which at the end of the game is like, do we have higher quality care for kids? And we had a big aha. We've had so much fun hanging out with Yvette because we're always so busy. And she shared with us just yesterday, she's like, oh yeah, now you know what I've been able to do? All of my teachers now have a half hour each day for planning, not while they're watching kids at nap time. And Virginia and I are like, whoa, we didn't know that. And that's gonna be one of our outcomes, that we want to track, because that's part of what the end game is, creating space for pedagogical leadership. So that's kind of where we're also hoping with this ability to put information in a way that you can make decisions. We'll track turnover rate. Like, can we get better retention of employees because she has more time to coach and mentor teachers? So.
Any other questions? I'd love to end on that super positive note that wow, here we have an alliance that is giving back time to its members. So that's awesome. Thank you all so much for your attention, not just in this session, but all the other sessions. And we have Louise closing us out this afternoon and hopefully some good lunch. So thank you so much.